A question I get all the time is, what type of training should a person have if they want to be operating chambers or open a hyperbaric clinic? Or as a patient, what should I be looking for from the clinic or from the office that I'm going to receive hyperbaric oxygen to make sure that I'm getting what I'm really looking for? And today I want to answer that question. Technically, there is no requirement for anyone who owns and operates a hyperbaric clinic to have to be certified. That being said, I strongly disagree with that as a concept. Hyperbaric oxygen as a field continues to grow year after year. It's really an exciting time to be a part of hyperbaric. At the same time, hyperbaric comes with an inherent set of risks and an inherent set of benefits. Certain people absolutely could be using hyperbaric oxygen as a patient. There are definitely contraindications to hyperbaric therapy. It's not for everyone. There's also so many different types of hyperbaric oxygen: mild chambers, hard chambers, lower oxygen air only chambers, or 100% oxygen chambers. There's such a wide variety of options when it comes to using hyperbaric oxygen. As a patient looking for hyperbaric oxygen as a therapy, you need to know what your issues are and ultimately what to look for in the right practitioner. And as a practitioner, you really need to understand, what is your patient base? What is your client base? Who are you serving? And the right types of therapies or the right type of equipment for you to use in your clinic will start to come to the surface just by answering a few of these questions. But no matter what, you really want to make sure that you're going to a place that really understands hyperbaric medicine, that really understands how to optimize your protocol, and at the same time, really understands how to optimize your safety. And so it's my opinion that any clinic that is operating a hyperbaric chamber should be certified. They should know the contraindications. They should know the benefits. They should know the current research. They should know the best way to implement this tool, the best way to build a protocol based on your needs as a patient or a client. They need to know the safety and the drug interactions. This is not just a sauna that somebody's going into or a massage that somebody's getting. This is a field and the delivery of oxygen, and it has an amazing set of benefits, but it also comes with certain risks. And we need to be able to know all of that and balance it to make sure that the patients are getting, the clients are getting exactly what they need from this therapy. No more and no less. If you've been subscribed to this channel, we thank you so much. We're very grateful. If you haven't subscribed yet, please hit the subscribe button. Please hit the like button. Our goal is to get the truth about hyperbaric oxygen out to the people who need it. And the more people who subscribe, the more people who hit the like button, the more likely this information reaches those people in need. 2 years ago, I wrote a course specifically designed for practitioners that are using hyperbaric oxygen for any other usage other than the 14 standard insurance-based FDA-approved conditions. In other words, in the United States, the FDA has deemed 14 different diagnoses on label for hyperbaric use. They're all very extreme, very severe, either life-threatening or limb-threatening conditions. Things like gangrene, osteonecrosis, osteomyelitis, diabetic neuropathy, non-healing wounds, things like this. Hyperbaric oxygen is also utilized for over 100 different conditions based on hyperbaric's ability to reduce inflammation, improve the healing and recovery rate, improve immune system function. All the same mechanisms that we use hyperbaric oxygen for the 14 approved indications are really the same indications that are at work when we're choosing to use hyperbaric for some of these off-label conditions. We've done an entire video series on hyperbaric mechanisms. So if you're curious about that, please look back at some of those old videos and see exactly what those mechanisms are and how they work. And so when we're choosing to use this therapy off-label, there's a different set of protocols, a different set of standards that we really should be considering as we apply this therapy for those patients. And the course that we wrote is exactly that. It, of course, goes through all the science. It goes through all the physics. It goes through the gas laws. It goes through the history of hyperbaric medicine. Anybody who takes any hyperbaric course, literally in the world, it should cover all of those same basics in detail and almost identically from course to course. What we've done is we've created a course that then goes into how to apply all of those same principles to these off-label uses rather than just focusing on wound care and focusing on diabetic neuropathy and these others. Not that that's wrong. In other words, just like I'm saying, you want to apply the right tool, the right type modality, lower pressure, higher pressure. You have to understand your patient's need and apply the therapy properly. You should also understand your goal as a clinic or your goal as a patient in terms of who you're looking for as a provider, and make sure that they got the tools that they needed to apply that therapy properly. And so the course that we designed is exactly that. It's a course designed specifically for those off-label uses. If your primary goal is to use hyperbarics for wound care, the course that we taught, it would not be the right course for you. Now, you can choose to add that course because we're all always learning. We should always be seeking to have more information and learn more about the modalities and tools that we offer. But as an initial phase, my course might not be the best if your focus is a hyperbaric clinic in a hospital setting, offering it for wound care and diabetes and osteonecrosis. At the same time, a typical wound care or course on label usage might not be the best course if you're choosing to utilize your hyperbaric therapy for some of these off-label conditions. Our course is designed exactly for that. I did create a video that describes our course in detail. We'll put a link below to that video as well. You can check that out and learn more about our course and why I created it and exactly what type of information you should expect to come to see that class. I teach this class somewhere between 4 to 6 times a year, and we teach it all over the world. For a list of those courses on upcoming dates, you could always go to HBOT USA and click on events, and you can see our schedule. In this next quarter, we have 3 courses coming up, 2 in our clinic in New Jersey, one of which is already sold out. The other one is a new date that we just popped up, and another one that's going to be in the Northwest in November. And so again, you could always check out upcoming dates so you can learn more about when we're offering these courses, if that's something that you need and or it's something that you're interested in. Whether you're a clinician or a patient, whether you're offering hyperbaric to the public or you're looking for it as a consumer, you do want to make sure that the clinic that you're going to or as a clinic that you're offering, that you have your safety director training. That is 100% critical. And you want your clinic director and your technicians to be certified in the type of hyperbaric ultimately that they're offering, whether that's certified in an on-label type use or certified in an off-label type use. My opinion is it does not really matter. You're going to get a great education, but you should get trained in the type of hyperbarics ultimately that you're going to be offering or that you're looking for. See you next time.